An 88-year-old woman was in severe pain in a care home, surrounded by staff, and no one knew. And it wasn't because people didn't care or weren't bothered, but because she could no longer say what was wrong. She could no longer put words to what was going on. And it was only after an MRI that the truth came out. And this happens more often than people realize. It happens a lot. So in this video, we're going to talk about why pain is so often missed in dementia. We're going to talk about three of the biggest red flags that people ignore, and what you should do instead, whether you're a carer or a family carer or a family member. And one of the biggest myths in dementia care is that they don't feel pain the same way anymore. But that's not true. That's not true. They do feel pain. They just lose the ability to explain the pain. They lose the words. So imagine you have a sharp pain in your hip or in your knee, but you cannot find the word hip or knee, and you cannot say it hurts, and you cannot explain where it is. What do you think happens then? What do you think will happen? Your body takes over. And in dementia, that language becomes behavior. And pain turns into agitation. Pain turns into aggression. Pain turns into withdrawal. And pain turns into refusal. But instead of asking why, we label it challenging behavior. And that's where we get it wrong. I've seen this myself. I remember in a care home I worked, a resident who was suddenly labeled as aggressive. Staff were saying, "Oh, she's changed. She's really difficult with personal care." And yes, the aggression only happened during personal care. So that was the clue. That was the big clue. And when we look deeper, she was in pain. And once that pain was addressed, the behavior disappeared, went away. She didn't change. It was the pain speaking. If you support someone with dementia at home or at work, this is something you cannot afford to miss. So please subscribe now, because this will change how you see behavior. So on to the 3 red flags. The first one is sudden aggression. If someone is usually calm and suddenly becomes aggressive, especially during care, don't jump to their being difficult. Ask, does something hurt? Because pain during moving, during washing, even during dressing. Imagine being woken up at 6 or 7 a.m. with achy joints. Your body has been at rest, so you might be stiff or you may have arthritis. How would you feel? how would you feel? So these are some of the most missed signs in dementia care. Number 2 is refusing food and drink. If someone starts turning away from food that they used to enjoy, that's not just poor appetite. It could be they have toothache, or they have mouth ulcers, or they have difficulty swallowing. It could be any of those. But instead, it gets written down as poor appetite. And what happens? It gets missed. And number 3 is withdrawal or shutting down. When someone becomes quiet or withdrawn or starts to sleep more, people often say the dementia is getting worse. But sometimes they are not declining. They're coping with pain that they cannot express. So here's what you should do instead. As a carer or family member or family carer, keep it simple. I'll give you the 3-step check that you need to do. The first one is change the question. Stop asking, what's wrong with them? What's going on with them? And start asking, what could be causing this? Number 2, look for patterns. Does it happen at the same time each day, or during movement, or when eating, or during personal care? Because patterns are clues. Number 3, watch. Don't just ask. In care, we use tools like the Abbey Pain Scale and Pain Aid. They don't rely on words, they rely on observations. Things like facial expressions, body language, breathing, and sounds like groaning or whimpering or calling out. Even at home, you can do the same thing. You just need to start watching differently. Pain in dementia is often missed, not because people don't care, but because it doesn't look like pain. It looks like behavior. And behavior gets misunderstood. Behavior gets misunderstood. And that's where people fall through the cracks. That's why pain is missed. So the next time you see a sudden change, please don't assume. Pause and ask yourself one simple question. Could this be pain? Because sometimes that one question changes everything. And in my next video, I'll show you exactly how to assess pain step by step so you don't miss it. But make sure you're subscribed. And as always, remember to be kind.